Now, the head of the WHO has warned against people thinking we're in the endgame in the pandemic, stressing that more variants could emerge.
Now, this comes as many parts of the world are still battling against Omicron, including Japan, which is set to expand its quasi-state of emergency to more areas. KIM Hyo-sun has more.
The head of the WHO is insisting it's not safe to assume Omicron will be the last variant of COVID-19.
But it's dangerous to assume that Omicron will be the last variant or that we are in the endgame. On the contrary, globally, the conditions are ideal for more variants to emerge. To change the course of the pandemic, we must change the conditions that are driving it.
However, addressing an executive board meeting of the WHO on Monday, he added the acute phase of the pandemic could still end this year if certain key targets are met. To do so, he stressed the international community needs to reach goals like the WHO's target to vaccinate 70% of the population of each country by the middle of 2022. He also stressed that improving testing and sequencing rates are also crucial to track the virus as well as emerging variants. Battling an intense Omicron surge, Japan is set to expand its quasi-state of emergency to 34 of the country's 47 prefectures. The measures, which will run through late February, include the shortening of opening hours for multi-use facilities like restaurants and bars. In China, authorities on Monday lifted the harsh COVID-19 lockdown imposed on the city of Xi'an. This comes after a month of some of the toughest public health measures in the world. However, the drastic lockdown appears to have worked, as the city, home to some 13 million people, has now reported a new case after daily infections hit a peak of over 330 in late December. The U.S. is also witnessing a drop in new infections, with its average daily new cases over the past 7 days dropping to around 690,000. This is down from the country's peak of over 800,000 reported 2 weeks ago. Despite the drop in new cases and hospitalizations across the U.S., COVID-19 deaths hit an 11-month high on Sunday, up 11% on week. Kim Hyo-sun, Arirang News.